What we hope for when we treat a patient with depression is within the first 1 or 2 or 3 choices of antidepressant, we'll find the right one for them. They'll get not only better but well, and they'll stay well. That's the goal of treatment for most patients. Unfortunately, some patients don't fall into those categories. In fact, tragically, many patients, maybe as high as a third, may not get better on the first or second or third or even fourth treatment. Those are called more difficult to treat patients, or their depressions are more difficult to treat depressions. If a person fails at least 2 courses of adequate treatment, we call them treatment-resistant patients. Now, there's a little caveat there. Failing is not the key. It's failing at an adequate attempt of treatment. So what does that mean? Well, some patients never get to an adequate dose. They stop at a dose which is really too low, and what some of the research shows is if we just would have increased the dose in that type of patient, they might have gotten better. Some patients don't take their drugs long enough. They stop them too early. And so it may look like they're treatment resistant, but they're actually not taking their medications right. But if patients fail at least 2 courses of adequate treatment, we call them treatment resistant. When we get to treatment resistant patients, we need to use different kinds of treatment. Sometimes it's a combination of drugs that work in different ways. Sometimes it's the addition of other medications. People may have seen in the direct-to-consumer ads, the ads for Seroquel or Abilify, which have been approved to add to antidepressant medicines to maybe improve the effectiveness of those medications. For some patients, it may require the addition of psychotherapy. For others, it may require the addition of more biologic treatment. There's a magnetic treatment now called RTMS, repetitive transmagnetic stimulation treatment, which is kind of like the old shock treatments, but it doesn't cause people to have to go to sleep, and it doesn't cause a seizure. So that may work for some. There's a biologic treatment called vagal nerve stimulation, where a nerve in the neck called the vagus nerve is actually stimulated, and that may help with depression. For some patients, it may require hospitalization, maybe even shock treatments. The point is, the goal of treatment is to get people well. And if the depression is difficult to treat or treatment resistant, it makes it more difficult to get a handle on it. But the goal is still the same, to try to get them over their depression.